when a large program across the country is being implemented, if you don't fix your objectives first, then it is likely that at the implementation level, you end up in doing something else, not what you were actually supposed to do. So that is why objectives are to be in place before you start doing anything. So even for planning purpose, even for planning, for what we are planning, what do you want, for which purpose you are planning, for that you need to have your objective, right? So my objective is to reduce the burden of malaria, burden of tuberculosis, or transmission of vector-borne diseases or some other um, uh, illnesses in the community. So, this is my objective. So, whether it can be achieved based on some background information, depending on the epidemiology of the disease, we will understand. We, in the sense, people in the planning commission, people sitting in the Niti Ayog. So they will come to a conclusion whether this can be achieved, and for them again technical support will be there. So they will sit and decide whether it can be achieved in a 5-year period or 10-year period or 15-year period, and accordingly they will fix an objective and goal. If a disease is almost under control, then what can be done in order to keep it under control? Then that means it should not come again. There should not be any resurgence. Or if any condition is, the transmission is on high, then what can be done to reduce the transmission or break the chain of transmission, right? So that is how, whether it can be done in 2 or 3 or 5-year period. You need to have long-term or short-term disease. If a disease is on the verge of eradication, so what extra measures you can take in order to eradicate in the next specified number of years. So that is the way they go with formation of objectives and goals. But all the conditions cannot be tackled because, as I said, we always have uh, limited resources. So only those conditions which have to be prioritized. How they prioritize? Based on their magnitude of the problem. Okay? They prioritize which has to be tackled first. They understand, they analyze from the data, and then they will prioritize. Okay. So objectives also help us to measure. It's like a yardstick to measure the work. So how much work we have done. So if you have a short-term project of 5 years, at the end of 1 year, at the end of 2 years, if you do an interim analysis, you will see whether you have achieved a part or a proportion of that end point what you are actually intending to achieve. At least a part of it is achieved or not. In which direction we are going, and at least partly we have achieved what we are supposed to achieve. Okay, so it's like a measure. It helps to, in order to measure the work, how much work has been done in implementation of a particular program. Okay. Then the third point is assessment of resources. So now you have your objectives and goals, and in order to reach the objectives and goals, you will assess what is with you, what is available with you. So resources available. For example, ఇప్పుడు ఈ కోవిడ్ సిచ్యువేషన్ లో ఇనిషియల్ గా స్టార్ట్ చేసినప్పుడు each district they decided whether we are self-sufficient in managing corona cases or not. So initially we didn't have more positive cases. So that time the requirement was to educate people about the disease, about the transmission, about the distancing, what is very much required, about the personal protective measure, and about how to keep, if there is any symptom, how to approach the health facilities. So these were the things. So for that, did we have, so at that time the planning was based on the resources. Do we have adequate number of places, like how we did in our district? I'm telling you. So in Vishakhapatnam, we had to manage the quarantine. How to quarantine? So we had at least 1,000 people per day we may have to quarantine depending upon the exposure. So especially high risk people who are coming from outside the states or countries, and then those who are contacts of the positives. So approximately 1,000. So how many establishments we really have to keep these people in quarantine for 15 days at least? Do we have the manpower? Do we have all the other facilities to keep them in quarantine for 15 days? What are the other materials needed? So in order, because he is high risk, if a doctor has to visit him and see whether he is not symptomatic and he's doing well, so he has to wear protective gear. So do we have adequate number of masks and other PPEs and all? Then are the doctors trained enough? Are the sisters trained enough to identify the symptoms? Are the hospitals having adequate number of beds? If we have sudden increase in number of cases, how can we tackle where to keep them? So do we have adequate number of beds? So all this is nothing but assessment of the resources. So this is how even at the national level, assessment of manpower and money, material, etc. is done. Like how many hospitals, government or private, total number of sub-centers, total number of ANMs, ASHAs, doctors, nurses, doctors to nurses ratio, per population, per thousand population, how many, these are all indicators which tell that this is the amount of resources we have at place. So we have to now struck a balance between what is required and what is available. So this is what is the third step in doing the planning. And then based on that, because if resources are less, if you have adequate resources, you can meet all the requirements. But if you have less resources, then you need to prioritize the problems. So prioritization will be done based on the importance of the disease and magnitude of the disease. So what we understand magnitude is increased burden. Okay, 100కి 50 మంది వరకు ఎఫెక్ట్ అవుతున్నారు అంటే large number of population are getting affected. So big burden, magnitude is big, or the rate at which it is affecting, infection rate and the transmission rate is very fast. If 15 people are affected, 10 are likely to get the disease. Okay, attack rate is high. So if such conditions are there, we have to prioritize and give importance to such conditions which are having high burden, where incidence and prevalence rates are high. And also importance in the sense, they are like they are of public health importance. Basically importance again means the same, where the prevalence and incidence are high. At the same time, the importance will be like those with stigma, those conditions with stigma, those conditions where disability rates are high, or those conditions where, for example, World Health Organization has identified certain conditions which are notifiable and they have to be under control or they have to be eliminated. So they are important disease conditions which have to be put to an end or at least control, right? I hope you all know the difference between control, elimination and eradication. Then attention has to be paid to the financial constraints. So another important thing is financial constraints, mortality and morbidity data. So mana financial constraints ante basically resources lone vastundi. Okay, so we cannot have that much funding anukunte limited resources lone whatever possible we need to do for reducing the disease. Then prioritize the disease which can be prevented at low cost. అంటే బర్డన్ హై ఉంది కానీ with less investment you can completely eradicate the disease. So such diseases can be again prioritized. So these are the various criteria. Magnitude, yes, definitely we have to bring down. Large number of people are getting affected, so we have to address it immediately. Then which can be prevented at low cost. For example, just by for a waterborne diseases ఉన్నాయనుకో, just by purification of water you can prevent waterborne diseases which need not be if you compare the cost of it, establishment of a purification plant is much cost effective as compared to producing a vaccine for that. So such things you need to plan. Okay, instead of investing on development of a new vaccine for certain waterborne diseases, why don't you break the chain by eliminating or the vehicle which is transmitting the disease. So here water is the vehicle which transmits. So why don't you make safe water available, which is much cost effective as compared. Then once priorities have been established, alternate plans have to be formulated. So ఒకసారి మీరు analysis, you have done the situation analysis, you have formed, you have understood the health needs and demands of the people, then you understood which has to be addressed, what are your objectives, whether they should be addressed in the next 5 years or 10 years, or generalized objectives are usually at the higher level. As you go down at the implementation level, the objectives are more specific, right? Then you have fixed your you have assessed your resources and fixed your priorities. Then start writing a formulated, you start writing a plan of action. You ante you kaadu, who, for a country, who is going to do the health planning? నీతి ఆయోగ్, అవునా? సో రైట్ అప్ ఆఫ్ ఫార్ములేటెడ్ ప్లాన్ అంటే ఒక ప్రోగ్రామ్ ఇంప్లిమెంట్ చేయాలి, నేను టీబీ కంట్రోల్ చేయాలి, లేకపోతే మలేరియా హ్యాస్ టు బి బ్రాట్ అండర్ కంట్రోల్. సో దానికి ఒక ప్రోగ్రామ్ చేయాలంటే ప్రోగ్రామ్ లో ప్రతి ఒక్క డీటెయిల్ ఉండాలి. అది ఎక్కడ స్టార్ట్ అవుతుంది, ఏ లెవెల్ విల్ బి ద implementation unit, then who will be in charge, who will do what job, what action is to be taken. Sir, for example, you will say spraying activity. So spraying activity has to be done aniste saripodu. ఏ స్ప్రే వాడాలి, ఎన్ని సార్లు వాడాలి, ఇయర్ కి ఎన్ని సార్లు చేయాలి, ఎన్ని రౌండ్స్ వేయాలి, ఏ ఏరియాస్ లో చేయాలి. సో వాట్ ఆ ఏరియాస్ స్పెసిఫై చేయాలి, బికాస్ అంటే డెఫినేషన్స్ ఇవ్వాలి. ఇలాంటి ఇన్ని నంబర్ ఆఫ్ కేసెస్ కనుక లాస్ట్ 1 month లోనో 6 months లోనో 1 year లోనో వచ్చి ఉంటే దాంట్లో మీరు ఆ పర్టికులర్ ఏరియాస్ కి స్ప్రేయింగ్ యాక్టివిటీ చేస్తారు. అలా అని యూ హ్యావ్ టు స్పెసిఫై. యూ ఇన్ ద సెన్స్, in the plan it has to be specified every action which has to be done in order to reduce whatever strategy you have. Every action under that program has to be specified at each level. Ante ground level lo, implementation level, mana we say there are 3 levels usually. I'll tell you in the management, usually there are 3 levels. The middle and the lower level are mainly for execution of the program, whereas the upper level is the management level, right? So lower level nunchi higher level varaku every person responsibility enti, every stage what activities have to be done, the process, the method of doing the activity, and what outcome is expected at each level. Everything has to be specified in the plan. So if you see Ministry of Health and Family Welfare తాలూకా ఏదైనా ప్రోగ్రామ్ డాక్యుమెంట్స్ చూడండి, దాంట్లో దే విల్ స్పెసిఫై who will do what at what time, how many days, then which areas to we covered, what is the definition of those cases. Let us say you have to identify fever cases in a survey. So who will do the survey? How long will be the survey? What areas will be included in the survey? Then what cases will be included? Fever survey అన్నప్పుడు ఆ ఫీవర్ అంటే ఏంటి, దేన్ని ఫీవర్ కింద తీసుకుంటారు, మైల్డ్ ఫీవర్ అయితే ఫీవర్ కింద తీసుకుంటారా, లేకపోతే 100 కంటే ఎక్కువ ఉంటేనే తీసుకుంటారా. సో ఎవ్రీథింగ్ హ్యాస్ టు బి స్పెసిఫైడ్. డెఫినేషన్స్, రెస్పాన్సిబిలిటీస్, roles and responsibilities, everything has to be specified in the formulated plan. And also an inbuilt evaluation అంటే ప్లాన్ ఫర్ హౌ టు evaluate. అంటే ప్రతి ప్రోగ్రామ్ కి ఆ ప్రోగ్రామ్ యాక్చువల్ ఏం అచీవ్ చేయాలో అచీవ్ చేసిందా లేదా అన్నది చూడడానికి ఇవాల్యుయేషన్ చేసుకోవాలి. అది కూడా ఇంక్లూడ్ అయ్యి మీరు ప్లాన్ చేస్తారు. అంటే హౌ evaluation will be done at the end of the implementation. So not only at the end, we also do periodic evaluation. Don't we evaluate you in between when we conduct the internal exam? What are we doing? So if we have started 6th and 7th semester classes, so how much you have achieved, how much we have achieved by teaching you, how much you have achieved by learning. So how do we know whether we are going in the right direction or not? So we do evaluate. We do intermittent evaluation or periodic evaluation. So in between we conduct in what is it, internal assessment exams. Similarly, here also we do some interim analysis, we do some feedback, we submit reports. Okay, every quarterly reports are submitted, every monthly reports are submitted, and at the center, state and center level, they analyze that data. Then actual implementation of the program. So when actual implementation, that means ఈ ప్రోగ్రామ్ రోల్ అవుట్ చేయాలి అని ముందు స్టేట్ సెంటర్ నుంచి స్టేట్స్కి వస్తాయి. దానికి కొంత ఫండింగ్ ఉంటుంది, అదేమో ఒకరికి రెస్పాన్సిబిలిటీ ఇస్తారు. సో హూ ఆర్ ద రెస్పాన్సిబుల్ పీపుల్? ది అథారిటీ, administrators who are at the state and the district level. So once it is rolled out at the state level, then again in the state level they will form certain phased manner lo ela roll out cheyali, daniki who is responsible, what roles he will play, and then what are the different actions taken anadi malla state will again plan. Okay, so and they will again roll out at the district level. So this will continue till the primary health center, and delegation of the roles and responsibilities to the concerned people who are going to implement it. Okay, this will be actual implementation. For example, Rashtriya Kishore Swasthya Karyakram. Okay, the need was health of adolescents. Adolescents, as you all know, they have some certain problems which need to be addressed. They can't be treated as adults. At the same time, they are not children, so they are a special group. Now this need was understood and a program was implemented for addressing the problems of the adolescents. Now they started a program, they launched a program called Adolescent Health Program or RKSK program. Now this program, they have mentioned, if you go to the internet, find out through Ministry of Health portal, what are the the program document for implementation of RKSK. So they have specified who will be the nodal officer at state level, who will be the nodal officer at district level, roles and responsibilities of a medical officer regarding the implementation of the program, what is the content of the program, what activities have to be done. Okay, and once it is implemented, feedback is given from the PHC to the district and from the district to the state, and then that feedback will go to center for any modification. Okay. Next step is monitoring and evaluation. So monitoring is basically day-to-day follow-up of activities. So whether the program is running according to or is implemented or proceeding according to the plan or not has to be monitored on a daily basis. It is nothing but keeping a track of the course of activities. Okay, whether our targets and objectives are fulfilled or not. So this is about planning cycle. I hope you all have understood about planning cycle, right? So if I ask you to draw a planning cycle, can you draw now? So start, you need not to write so many blocks. You can write start with for gather health data, analyze, form situation analysis, formulate the health problems, prioritize, formulate the program, the assessment of resources, fixing priorities, then formulate a plan of action, implement a plan of action, and then monitoring and evaluation. Right. So, but one thing, if any program is implemented, but it is not monitored or managed well, then uh, then the outcome will not be what we are actually intending to achieve. Okay. So for that, what we need a proper management. So implementation ఒకటైతే management and planning చాలా బాగా చేశారు, ఇంప్లిమెంట్ కి రోల్ అవుట్ చేశారు, కానీ ఇట్ వాజ్ నాట్ ప్రాపర్లీ మేనేజ్డ్ ఎట్ ద ఫీల్డ్ లెవెల్. సో వాట్ విల్ హ్యాపెన్? ఫెయిల్యూర్. ఓకే. సో ఫర్ దాట్ ఐ షో యూ అనదర్ స్లైడ్. అమ్మా ఈ స్లైడ్ పెట్టాలి ఒకసారి. సో వాట్ ఈస్ మేనేజ్మెంట్? ఉంటుంది కదా, అలా అలా అంటుంటారు బ్యాండ్ అంతా వాయిస్తుంటేను అలాగా. సో వాళ్ళు ఏం చేస్తారు, ఇక్కడ డిఫరెంట్ పీపుల్ ఆర్ దేర్ అండ్ యూ కెన్ సీ దేర్ ఆర్ డిఫరెంట్ కైండ్స్ ఆఫ్ పీపుల్. A person who is actually doing the job at the ground level, person who is maintaining some account, person who is simple carrier of a person who is carrying like loads, and a person who is again implementing the design or something like that. And these are all administrators or office officials. So there are different cadres of people and all cadres are being managed by this person. Ante okay, I agree with Venkatesh what he said. Allocating appropriate job to an appropriate person, at the same time see that job is done. ఓకే, ఒక మనిషికి పని ఇచ్చినంత మాత్రాన వాడు చేయాలని లేదు, అని వాడు చేసేటట్టుగా వీడు చూడాలి. రైట్. సో మేనేజ్మెంట్ ఈజ్ అన్ ఆర్ట్ of getting things done through and with the people in a formally organized groups. It's an art of creating an environment in which people can perform and individuals can cooperate towards attainment of group goals. So ఇక్కడ individual goals రావు, group goals. So వాళ్ళు అంటే ఒక team of people ని together he should make them work and achieve the goals. That is management. Okay, getting things done through and with the people. So, and people are not individuals here. They don't work individually. They work for the organization. ఇప్పుడు మన హెల్త్ సిస్టమ్ లో ఉన్నాం. We are not working for ourselves. We are working for the country, for the health system. When people are in group, now the management or the right management is an art of creating an environment in which people can perform their best. They will cooperate with each other and work in such a way that they can attain the goals of the organization. So, management is an art of knowing what to do, when to do, and see that it is done in the best possible way. Ante doing the right thing at the right time using the best method. Kada? Or getting the right thing done at the right time, utilizing the best possible method. Okay, so management is a goal oriented uh, process. It's a social process, an integrating process, and a continuous process because it integrates humans, physical, materialistic things, and also finances. So, finances లేకుండా పని అవ్వదు, ఈ మెటీరియల్ థింగ్స్ లేకుండా పని అవ్వదు, చేసేయడానికి మనుషులు కావాలి కాబట్టి మనుషులు లేకుండా కూడా పని అవ్వదు. సో దిస్ ఇంటిగ్రేట్స్ త్రీ థింగ్స్: హ్యూమన్స్, physical, material, and financial resources. It's a continuous process. So continuously or constantly, when even the system is working, we feel that the system is working smoothly, but we need to identify the problem and solve the problem by adequate steps. So as I said earlier, there are levels of management. So at the implementation level also, we see three levels: top, middle level, and low level. Top level is the administration level. Middle and the low level are the executory level, execution, where the program is actually executed or rolled out. And low level is the frontline managers, the frontline workers who actually do the work. And above that, there are also supervisors, that is the operational part. So management actually not only management, but it includes planning, organizing, staffing, directing, and control. Right? So this mnemonic has been used: P for planning, O for organizing, S for staffing, D for directing, C for coordination, and R for reporting.